Today we will be talking about inflammatory jaw lesions. So osteomyelitis is by definition it is an inflammation but not necessarily infection of bone and bone marrow. The term osteitis may be substituted for osteomyelitis to indicate inflammation of bone. Pulpitis is an inflammation of the dental pulp or tissue in the center of a tooth. The dental pulp comprises of a soft connective tissue, nerves, and blood supply of the for the tooth. Pulpitis causes pain, swelling, sensitivity. A bacterial infection from a cavity is typically the cause. So periapical abscess, from its origin in the pulp, inflammatory process extends into the periapical tissue where it may present as a granuloma or cyst or an abscess if it is acute. So acute osteomyelitis is the inflammation of the bone and bone marrow of the mandible and maxilla results most often from extension of a periapical abscess. The second most common cause of acute osteomyelitis is physical injury such as occurs with fracture or surgery. It may also result from bacteria. So chronic osteomyelitis may be one of the sequelae of acute osteomyelitis, or it may represent a long-term, low-grade inflammatory reaction that never went through a significant or noticeable acute phase. In either events, they have many similar causative factors. However, most cases of chronic osteomyelitis and in most infections, the clinical presentation and the course are directly dependent on the virulence of the microorganism involved and the patient's resistance. Diffuse sclerosing osteomyelitis. It represents an inflammatory reaction in the mandible or maxilla believed to occur in response to a microorganism of low virulence. Bacteria are generally suspected as the causative agents, although they are seldom specifically identified. Focal sclerosing osteitis. It is a relatively common phenomenon that is believed to represent a focal bony reaction to a low-grade inflammatory stimulus. It is usually seen at the apex of the tooth with long-standing pulpitis, may be adjacent to a sound, unrestored tooth, suggesting that other causative factors such as malocclusion may be operative. That would be all. Thank you.